Welcome to the IAH for Veteran weekly live stream. This evening, we will be discussing the power of relationships. The importance of healthy relationships is critical for your physical and mental health. The benefits of belonging to a social network arise from reciprocal exchanges with others, be they family, friends, co-workers, or social or political organizations. These networks have value for health. The following tips can assist as you explore enhancing social connections. 1, consider social capital and ways to increase it. Social capital refers to the value of belonging to one's social networks. All the benefits arise from reciprocal exchanges with others, be they family, friends, co-workers, or social, political, or religious organization. These networks have value for health. You contribute to relationships, and just as other people or groups can count on you if they are in trouble, you can count on them. Your contributions to relationship increases your chances of receiving support in the future. An example of social capital may be shared connections between two alum from the same college. They are more likely to connect and share various resources. There is a strong positive relationship between social capital and mental and physical health, and it seems to be protective of mortality. Noting that it is still unclear how social capital influences specific health outcomes. 2, joining a healthy group of some kind can be valuable. Strategize with veterans about which group they might like to join, respecting that some people are introverted and need to strike a healthy balance between social time and alone time. Encourage veterans to explore their options and have a list of options handy. These may include the following: volunteer programs, support groups, social media, help with a community garden, join a gym. 3, become more active in the local community. Attend community events like civic celebrations, stage productions, and fundraisers. Attend local supporting events. Help with directing or organizing community events. Join a religious or spiritual community. 4, your health is influenced by the number of close confidants in your life. The number of confidants is more of a health indicator than how many friends one's had or how many people one knows. That is, the quality of relationships matter more than the quantity. Ask people if they have someone in their lives they can confide in, someone they are comfortable telling their secrets to, or with whom they can share what is going on with them regarding their health. In one study of older women, lack of a confidant was associated with lower reported physical function and vitality. Unfortunately, the number of confidants per person has dropped over the years in the United States. On the positive side, while people may not know their neighbors, and while people are less engaged than they used to be in civic activities, a 2009 report concluded that mobile phones and online social media might be helping people to connect in other ways. With the COVID-19 pandemic, concerns have been raised about the infodemic, the effects of a considerable amount of harmful media exposure, and an increase in behavioral health problems. 5, having a close relationship with a significant other is also health promoting. Being unhappily married seems to be associated with worse health outcomes than being single, and a negative partner interactions are associated with higher rates of depression, anxiety, and chronic illness. Being married and being a parent was linked to well-being and mental health in old age. Recent research has also indicated that legalizing same-sex marriage has also had numerous health-related benefits. Study also suggests that involving loved ones in your treatment can improve outcomes for both you and the relationship. 4, healthy relationships. 6, connecting with animals can be a powerful healer. Animal-assisted therapy, or AAT, has been found to have several health benefits. Having a companion animal reduces depression and loneliness, decreases anxiety, and enhances social skills. It often promotes a physical activity. Older adults with depression may benefit from AAT. Veterans who have found equestrian therapy program, working with horses, therapy, dog visits, or programs beneficial. 7, heal or avoid negative relationships. Conflicted or unfulfilled relationships can have a negative health impact, as you might expect. Intimate partner violence is experienced by over 1/3 of American women and psychiatric patients. In addition to physical injuries, it may cause depression, anxiety, PTSD, psychosis, self-harm, and many psychosomatic conditions. Marital conflict is associated with poor pain tolerance, higher blood pressure and heart rate, and significantly worse cardiovascular outcomes, endocrine function, and immunity. 8, cultivate communication skills. Everyone can learn simple communication skills that foster better connections with others and help them avoid negative interaction. Some examples of approaches you can teach yourself include the following. Listen well. Listen in a way that you are present, fully mindful of what the other person is saying. Listen with your entire self, using your ears, listening with your heart, tuning into emotions, and observing body language closely. Good listeners are not judgmental. They can share about themselves without over disclosing. Inquiry. Inquiry helps the other person to draw their conclusions more efficiently. It does not involve the listener trying to impose those conclusions on them. Good communication involves actively reflecting on what has been said to you and showing the other person through clarifying questions that you are generally interested in them. Nonviolent communication teaches a series of steps one can follow in communicating with others. It was designed to steer interactions away from blame and criticism to a place of greater empathy and understanding. NCV assumes people share specific fundamental needs and are compassionate by nature. We can unlearn strategies that involve violence and come together through our common humanity to solve interpersonal differences. The process might include making an observation about an event and sharing the feeling it provokes, rather than generalizing about the experience. NCV focuses on considering what you and the other person need, then both people outline concrete steps to improve the situation. I statements. I statements are another commonly used communication tool. Speaking strictly for yourself gives another person space for their opinions, beliefs, and thoughts that might be different from yours. Sentences that begin with I rather than you. For example, rather than generalizing by saying, it is bad for you to do that, a person could say, I'm opposed to doing that. Instead of saying that movie was great, a person could say, I like that movie. What did you think? These statements do not attribute feelings to the other person, but make the speaker's feelings and thoughts clear, and this supports healthy dialogue. Approaches for developing communication skills. There's a model that uses 4 models to improve your communication. 1, invest in the beginning. Introduce yourself and put the other person at ease. Ask open-ended questions about concerns. Plan out the discussion and the other person. What do they want to accomplish with the conversation? 2, get the other person's perspective. Ask them what is going on and what is concerning them. If you speak of illness, explore how it was affected their lives. 3, empathy. Empathy is the ability to experience what is going on with others mutually, thoughts, experiences, and emotions. Be open to the other person's feelings and show them through verbal and nonverbal communication. We know that empathy is an influential contributor to health and well-being. 4, invest at the end of the conversation. Involve the other person in deciding the following steps. Practice compassion and loving kindness. There are many ways to do this. Loving kindness meditation is a traditional Buddhist meditation that focus on benevolence and support toward self and others. Compassion-based interventions focus on turning into the suffering of oneself to others with a commitment to prevent it. Compassion-based interventions and loving kindness meditation have many benefits, whether a person is struggling with health concerns. These types of meditation lead to progression and favorable changes in brain function. They increase mindfulness, positive emotions, compassion, and self-compassion. Loving kindness is effective in treating chronic pain. Compassion meditation is found to help with psychotic disorders, affective disorders, major depression, eating disorders, and suicide risk. A combination of the two was helpful with a borderline personality disorder. Loving kindness meditation. While many exercises have you focus on what is happening with what you're thinking, this one focuses more on your heart. Make sure you are in a comfortable position, close your eyes, or rest them comfortably with a soft gaze on a place a few feet in front of you. Begin with 5 deep breaths. 1, 2, 3, 4, 5. Focus on your abdomen when you breathe. And as you breathe out, your belly should pull back in. After you have settled into being aware of your breath, focus on the area around your heart. It can help to focus on people who warm your heart or memories that make your heart sing. With each breath, draw love, compassion, and acceptance into your heart. Turn your attention to feeling compassion for yourself and others. Recognize that compassion is a desire for freedom from suffering. In this state, visualize radiating how you feel in your heart to everyone mentioned in the statements below. Without judgment, notice the feelings, thoughts, sensations, or images that arise. The following are some questions for consideration. These are some of the things that I have done or I am currently doing that I would define as improving my relationships. 2, the following are some possible places to volunteer in my community. And 3, what are 3 to 5 things I might start doing on a regular basis to improve my relationship with others? Make sure you complete these questions because these exercises are important process in the IHH for Veteran program and to improve your communication skills. I will see you next week on the next IHH Veteran for Health live stream. Thank you and good night.